Good afternoon, good morning, everyone, depending on where you are, and welcome to today's webinar. Let's wait a few more moments to see if more people are joining. Maybe in the meanwhile, you can put in the chat box where you're joining from. In the meantime, my name is Steven. I'm your host for today. I'm leading the business development team at Rods&Cones, and we're excited to have you join us as we explore today here how visionary leaders like Dr. Ruben De Groote and cutting-edge technologies like Rods&Cones are democratizing robotic-assisted surgery skills. Our special guest today is Dr. Ruben De Groote. He is a renowned urologist from the OLV hospital in Aalst, and that is in Belgium, but he's also the founder of SearchQuest. And with SearchQuest, he is pioneering bi-weekly free virtual surgery observations, reaching surgeons worldwide. His dedication to education and to innovative use of Rods&Cones and live streaming surgeries has set new benchmarks for global surgical training. So first of all, I want to thank you. I know that you have a very busy agenda. I've seen you've had cases in the weekend. I see you just came out of surgery a couple of minutes ago. So thank you for making time for this. You've had an incredible journey so far, not only as a leader in robotic-assisted surgery, but also as an innovator in surgical education. And I draw a picture here with us, which for me combines a lot of what you're doing. Can you start by telling how you got inspired in pursuing this path, and how do you balance your clinical, educational, and entrepreneurial roles that you fulfill?
So first of all, let me thank you, Steven, and also let me thank the Rods&Cones company for their ongoing support for the initiative that was taken to have this webinar. I think it indicates how you guys at Rods&Cones value education, and how you value it a lot, and how you think that education in the future should look like. I think that the time where we were interns and we were standing at the fourth row behind the professor, seeing actually absolutely scratch and just having the experience of being in the OR but actually not knowing what was happening. Luckily, I think that's behind us, and I think that we should, for that reason, embrace technology for online education in order to increase the learning experience by the people who are watching. I think it enables perfect vision. It gives you the possibility for interaction on a very personal level. You can even do digital annotation. So I think that the possibilities that we have with this technology are absolutely astonishing. And I think that we have to move that way more and more. And I think that the fact that your guys are doing these kind of webinars to highlight this is just a sign of a good vision on how the future of surgery and how the future of education should look like. So maybe I can tell a little bit about my journey first.
Please do.
So I was trained here in Belgium. I'm from around here near the OLV hospital Aalst in Belgium. And so I always knew during my studies of medicine that I wanted to do something surgically. And at some point I was lucky enough to do an internship here in the OLV hospital Aalst, where I got in contact with my mentor, Professor Dr. Alex Motri, who still is a fantastic surgeon. He is one of the founding fathers and one of the pioneers of robotic surgery worldwide. And so I saw him operating, and I saw also already at that time, and it's already more than 10 years ago, that he had a lot of people around him, learning from him, watching how he was doing surgery. And it was him who actually got, have given me the interest and the willingness to go further in this, not only in robotic surgery, but also in the eagerness to train people and to bring your own knowledge to other people.
Right.
Now, at that time, I was trained myself at some point by Professor Motry, and I was trained according to the so-called see one, do one, teach one methodology.
Yeah.
And so this means that actually I was taught learning how to operate on patients. But at that time, Orsi Academy, very well known and renowned robotic training center
Yeah.
in near Ghent in Belgium, was developing. And there they were learning how to apply a new methodology. It's called a proficiency-based progression methodology. And so there we get people on site to learn on models, dry lab, wet lab, how to do proper surgery until you get to proficiency levels. And SearchQuest was actually like sort of an extension on a digital basis, in line with Orsi Academy. And so that's how the idea came.
And I'm sure there were some challenges that you had to battle with to set up an international training platform. How did you overcome them? Because it's quite a new approach, live streaming twice a week. Honestly, we haven't seen many others doing that. Can you explain us a bit, like how did you, what kind of entrepreneurial challenges and practical challenges that you encountered, and how did you deal with them?
No, absolutely. I think you perfectly describe it, because the setting up the training platform, that's actually not a medical affair.
Correct.
It's really a new world which was opening for me. And also there I had the support of Alex, of course, because with Orsi Academy, he's half doctor, half entrepreneur. So I was lucky enough to already be surrounded by people who are actually quite experienced in being entrepreneur. So you first of all, you need the money, so you need the finances in order to develop a learning platform. What you see is not only what you get, because we stream a lot of videos, so you don't have to download. So, for instance, you need a very big backbone of video digital capacity, which have to enable viewers to actually have a very good viewing experience without losing actually a lot of video quality. The development by the platform itself, it's very, very expensive. So the financial issues that first of all were there. So we had to do some investments ourselves. Luckily enough, we were organizing events in order to get this sponsored. Of course, there are also some ethical issues, because if you want to do live streaming of surgeries from an OR, you have to make sure in these kind of times that GDPR is approved and is always respected at all times. So it took us a lot of effort with compliance, with the compliance department of a lot of companies in order to get this through. And it took more effort and more time than actually I was imagining beforehand. But I think if we see where we have landed now, I think we can be very, very happy with the result that we got so far. But in my opinion, it's only the beginning. I think we can be happy with the progress that we made, but it's only the beginning. It's only the tip of the iceberg. I think that a lot of perspectives are possible in the future.
What I find so amazing about SearchQuest is indeed there are many training platforms that have a lot of inspiring educational videos, and they do webinars, and they have a lot of activities. But you guys are really streaming several times per week, which is for us like it's quite exceptional to see a group really streaming so much. But also I wonder, like, were you really aware of the benefits of live streaming? Were you really pursuing that, or did you see it like as a more where you're looking for interactivity with your customers? Because what we've seen actually is that research actually shows that live streamed surgeries have educational benefits, and actually there is it's shown that it is an enhanced learning experience. You have a better retention when you see a live stream, when you see a complex situation, somebody managing until bringing it to a good end. There is interactivity. We talked about it before. It's not a given, so people are always shy to ask questions, but the technology is ready to do it. There is improved accessibility, so you can actually reach anybody anywhere in the world as long as they have an internet connection. So a phone can be enough. And yeah, there are ways today to integrate advanced technologies. You work a lot with robotic systems, so people can see not a 3D but a 2D exact copy of what you're looking at when you perform surgery. There are cameras, high definition cameras that can see you as well operating. So I've seen a lot of, we talked about it as well. Like there's not only your public, it's not only surgeon, but also people in medtech. No, like can you talk a little bit about that?
So I think to address the first part of your question first, I think the unique given about SearchQuest is that is done in collaboration with ORC Academy. And so ORC Academy is a real hub of innovation. It's a bruising, melting pot of young people who come together, who meet experts in the field. So, and because of that, we have already a very good knowledge of people and acquaintances who are extremely experienced and talented in robotic surgery. So the aim is to go for quantity. So you need a minimum number of video feeds and also content on the platform that you should be able to offer the viewers, because I mean the offer in surgery is quite diverse. So you need to be able to show at least a minimum, but the absolute requirement is that what is shown on the platform, whether it's live surgery, whether it's pre-recorded surgery, whether it's a keynote lecture, for instance, it needs to be of good quality. So quality matters. So we don't want to go for a platform having like, YouTube, where millions of videos, where there's no single quality control, where actually everyone can contribute without any limitations and any quality control. So we don't want to have that. We want to have something which is big enough, but where is quality control already been done for the viewers. So if you are a viewer and if you're going to SearchQuest, you can be absolutely sure that this content has been reviewed by people who know what they are speaking about. And so we are making this selection for people. So for some type of surgery, you will not find 20 different kinds of surgeries. You will find a pre-selected number of cases selected for the viewers at home. So that's number one. So I think quality matters at all time. If we do live surgeries, also here in OLV and Aalst, and this is how it grew actually, we have a long-standing tradition of doing live surgery at international conferences, where you actually do the surgery being moderated by moderators on site. Now we want to take it one step further, because we don't only want to bring the live surgery to a big auditorium at the conference. We actually want to bring, and Rods&Cones is ideal for this, we want to bring the live surgery actually to the living room of the end users. And not only that, we want to make it an ideal learning experience, because you can watch someone, but sometimes if you get feedback from someone directed to your question, this is highly valuable. And so if you have and so we give people that watch the live stream the opportunity to get in touch with us in the OR by questions, by questions that they can ask through the Q&A box, but even they can actually speak to us in the OR. So this is, for me, this is a unique given. I wish I had that when I was a resident, that actually I can tune in an OR with surgeons who are actually very good at what they do. And I'm not speaking about myself here, I'm speaking about my colleagues as well, that they can actually address immediately your questions, and you can even have the opportunity to draw on your own screen at home so that the surgeon can see what you mean. I mean, this is for me an unbelievable advantage in surgical training. And I know this because already from experience, there is a very good Polish surgeon. He's became a good friend of mine. He is actually almost tuning in on every single streaming that we do. And so he's very young still. And a couple of weeks ago, he asked me, can we have just an evening, 1 hour together to review one of my cases?
Mm-hmm.
And he was operating so well and so according to the principles that we use in OLV that you can actually see that he was trained to the search class principles. And so this motivates me to actually go further with this, because you see that people don't have to come on site anymore in order to learn how to do proper surgery. Um, and to come back to the last question, to the last part of your question about MedTech, yes, absolutely. I think SearchQuest is the ideal example, which proves that medical society and MedTech goes hand in hand. SearchQuest only exists because the support we get from MedTech. We are organizing live surgical events, live stream. We're organizing webinars, and we are trying to do this, of course, in such an objective way as possible, because we are actually neutral. We don't really benefit
Mm-hmm.
of promoting one product over another,
Right.
and this is, I think, our strength.
Mm-hmm.
But we do have to state that without MedTech and their financial support, all of this would not be possible.
Mm-hmm.
And I think that for this we are very, very grateful, and we are very, very grateful with companies like Rods&Cones, that the scientific content can go hand in hand with the technological evolution that is made possible by the MedTech.
Let us talk a little bit more about that. Like you use a lot in your live streaming. I've seen only using the Google robotic system. So basically, what you do is you use what we call our mirror system to take the video out of the robotic system, and that allows you to stream an exact real-time copy of the laparoscopic view. Then you have as well like a webcam, 360-degree webcam, like a PAN-OR position, so people can see you working as well with your hands and sitting you behind the device. Everything, for the ones that are not familiar, so everything is Wi-Fi connected, so there is no wiring. It also makes it portable. In theory, they can use it in different ORs. And like you said before, Ruben, like the GDPR compliance rules, HIPAA compliant solution, of course, of utmost importance for any institution. Our solution is GDPR and HIPAA compliant by design. So we really made this a way that hospitals and surgeons feel comfortable for this. No? So I took a few screenshots of how this looks like when you're working, and then the ones that the attendees, the ones that are participating in your live streaming, those get an email from SearchQuest with a link. It's all scheduled. They can click on the link and then just open in the browser. They don't have to install any software. They have this unique link, so they cannot forward to somebody who can then also participate. They see and hear you explaining what's happening during the surgery. And like you said, no, there is this opportunity to interact with you. So they can put questions in the chat box. They can ask questions, or your moderator as well can actually. If somebody raised a hand, they can activate the microphone and they can start asking questions to you. Now, can you explain us a little bit like what kind of preparation goes into setting up a live stream in the hospital? What kind of steps do you take? Who does it? How long does it take? Can you elaborate a bit more on that?
Well, I mean, so far we are very, very happy with the system which is been provided by Rods&Cones. I think one of the key advantages here is it's very compact. So everything you need is one little suitcase. So you don't have these big, hardware which need to be shipped or put in a van. So actually you just have a little suitcase where everything is being fitted into. So you have, of course, a device which is streaming the laparoscopic view. This is, of course, mandatory to have in order to do the live stream. But it's also very, very important is to have an outside view. So as you see on the right-hand side of the slide, you see the outside view, because seeing how the hands and the feet of a surgeon are actually moving, this is already also something very, very important. These are very little details, but these actually can make the surgery a little bit easier. Also, the setup of an OR, I mean, it's all part of getting the optimal result. How the robotic console is positioned in the OR, how the machine is positioned around the patient. So having an outside view is also very, very important. And then again, we have also, again, we mentioned it already, GDPR is extremely important. If you send out links to follow live surgery, this needs to be secured. And so there is no single possibility to share these links. So everyone who is watching our stream, we know who they are and who is entitled to watch it, because you have to register up front. So yeah, I mean, I think the system by itself is working very nicely. We are actually planning in the near future to also have a very close collaboration with our colleagues from Bologna University to also do live streaming there. I know the professor, Professor Schiavina there personally. He's a very good surgeon. He's also very eager to actually participate in this live streaming concept. And what we will do probably is to send one of our boxes of the Rods&Cones just to Italy, so that they can actually start using it. Now it's very easy to start using it. We have a dedicated fellow who got trained by the guys from Rods&Cones. It's very easygoing, so it's not that much to learn about. You just have to know how to set it up.
So you have the same person.
It's very,
sorry to interrupt. So you have the same person, like,
yeah,
who is responsible of Rods&Cones, and he or she sets up the device a little bit before you start.
Yeah. Yes, and so it's a talented female fellow that we have from Italy, and so she was instructed how to use the system, and of course she shows ambition. She shows how to to be engaged in the surgery, and in return, of course, they get more exposure as well. Today, she was even performing some of the steps of a procedure live during the transmission, because we also want to show that education and training is not only showing surgeons how to perfectly do a procedure, let's call it like this, but also you sometimes have to show other people who are actually in training how they are being trained. Sometimes from maybe a little bit suboptimal performance, you can also learn a lot, because they are being redirected in a better way. And this is, I think, also some of the key features that we want to show.
Yeah. In the meantime, I'm here. I'm showing a little bit how this experience looks like. In this case, I don't have the sound on it, but indeed, you wear your own headset. So you wear your AirPods or any Bluetooth connected headset, so people can hear you speaking very clearly. I think full HD streaming, and then you would have like a person in your team responsible for it. But also that person can take the role as a moderator, right? So if somebody has a question, they can connect somebody as well, talking directly to you. And I think it's very wise what you do, that you have somebody from your team, like a fellow, because that person, it's invaluable, of course, if they know when to interrupt you and when not. No, like they have to be a little bit tactful sometimes with that, right?
No, absolutely. So, I mean, the plan is to also involve more, key opinion leaders and robotics, like Jim Porter, for instance. Jim Porter is together with Alex Motry. He's one of the founding fathers of robotics. He's located in Seattle. He is very much dedicated in robotics, also using the Hugo system from Medtronic, which we were using for the live stream. And so he will be in one of the upcoming sessions, being appointed as a moderator. So he will be continuously in touch with us, asking us questions, giving us feedback, because also, like, as an end user, as someone who is watching the stream and actually hearing the connection between the surgeon and the moderator, this is also highly educational, because some specific parts of the procedure are being highlighted. So that's always more interesting than just to see a surgery without actually getting any feedback verbally. So yeah,
Yeah,
absolutely.
great next action that you have prepared with inviting KOLs from other continents, even like yeah, really nice. One curiosity, Ruben, I've been several times in your webinars. Now I know a lot of our customers, they're struggling to start with a scheduled live stream very punctual. So sometimes they have to prepare the patient. Things take time. Nevertheless, I've always seen you starting like super punctual, even closing quite punctual. Any secret? How do you do it?
No, there is no secret there. I think there's so we have the habit of performing surgery in two parallel operation rooms. So this enables us actually to optimally use our surgical time. But this asks for quite a lot of planning up front. You really have to make an estimation how long a case will take, who is with you, who can help you. Some parts of the procedure are being performed, of course, under direct supervision by proficient fellows who are already proven in the lab that they are proficient. So yeah, I mean, it asks meticulous planning, and this is something you can learn, but you have to have a feeling about it as well.
It's practice.
You
Yeah,
have to feel confident as a yeah, you have to feel confident as a surgeon that also when things are going wrong, that you can actually correct it. So yeah, it's not that easy to plan, but and so far it went actually all right.
so a little bit on the feedback we have now, like with you and other customers, like interactivity. It's a highly appreciated part of live streaming, and if you compare it to traditional methods, uh, it's mostly limited accessibility. Of course, it's probably the biggest one. You know, you democratize the access to high quality educational content. You only need internet. You can follow it on a phone. The engagement level, it's tricky. We know, you know, like the technology is there, but people have to ask questions. So a moderator can help, and it's a very flexible environment. And like you said, like the interaction is is key. Now, what I wanted to ask you on here is like you've seen that as someone who embraced live streaming, how do you see the balance in teaching between in-person, simulation-based, and remote or virtual education? They're complementary, of course, so it's not one is replacing another. How do you see that in the future?
Well, it's interesting to see how it will evolve. It will ask some time to change the old habits. We on a very regular basis we have people coming from different places, nationally, internationally, coming to our OR to watch our cases, to have interaction with us. But sometimes actually, I suggest the ones who are sponsoring these kind of visits, why don't we do it online? Because the level of interactivity will be the same, maybe even better. They can follow sometimes also better. Of course, you don't have that that sense of experience of being in the war and like feeling the adrenaline. That's okay, but I don't think that is necessarily adding a lot to the learning experience. So I think that probably we will move progressively towards a more online way of education. We see that this is probably the future because if we organize a live surgical event, we have like the last Saturday we had a global surgical event that we were organizing. We have viewers from more than 45 different countries around the globe, and this is not only Europe. This is not only the western part of civilization. We have a lot of viewers from Asia, from Africa, from regions in the world where they don't have access to robotics. So this, as you put it nicely, I think this is democratizing the access to high tech surgical care. And of course, with prices probably will dropping in the near future for technology such as robotic surgery, this is actually the way forward to actually bring in this kind of technology in these kind of countries. And you see that people are already preparing, otherwise they wouldn't watch these kind of events. So yeah, it's a digital highway to surgical innovation.
Yeah. I've put in a poll here. If you go to the bottom at the right hand side, I ask them. People can answer it. They can put a vote. They can submit a vote. Like, what do you see as the biggest opportunity for medtech and supporting surgical education through live streaming? Because you mentioned like it's going hand in hand. No, like it can be sponsored. It's also a great way to give visibility to the devices that are used. But let's continue with, in the meantime, for some key takeaways that I think can be shared for both medtech people and HCPs. Let's start with healthcare professionals. So live streaming is actually a way to enhance your skills by participating in live surgery sessions with real-time interaction. Key takeaway is like embrace those digital platforms like SearchQuest. They're accessible from anywhere in the world. It's an opportunity to collaborate and to share knowledge, so you can contribute expertise and engage with peers worldwide. And like you said, you start getting in touch with somebody, and relationship starts to help each other further, and prepare yourself for the future. No, like it's already happening, but stay ahead with robotic surgery innovation. Stay ahead with AR, VR, AI, big thing that's everybody talking about now. Maybe a few key takeaways that for the medtech industry leaders. So yes, empower your education with technology. Any tool, Rods&Cones or any other tool, please use it to democratize your surgical learning. Also collaborate with educators, and you'll find for sure in any specialty people like Dr. Ruben, who can create impactful training programs, who are also very good communicators and know how to use these technologies to deliver high quality educational results. Enhance your user experience. I think it's a very big one for the medtech industry. Still really depending a lot on on-site events, which of course we acknowledge the value of them. But using this kind of technology is also a way to offer your customers like a very comfortable, flexible way. You give actually more to your customers. We don't want you to stop with the on-site events, but a technology like this can actually connect them to other KOLs in a very comfortable and flexible way. It's easier to match agendas and plan for the future. So align trends with remote education. It was a big one when the pandemic started, but we see it's still growing and growing. The remote education, the technologies are there. It's easy to implement. So yeah, I think we've covered already a lot of ground. I was wondering if there are any questions right now from the audience as well. I want to thank you already, Ruben, for sharing the way you're working and the way you envision this.
It's my absolute pleasure. Thank you for the invitation.
In the meantime, now that I don't see any questions, I have a few. So how do you handle unexpected challenges during live surgeries?
I mean, live surgery is what live surgery is. I recently was 2 weeks ago. I was in Florence. There was a master class on robot-assisted partial nephrectomy. So far, when I was performing live surgery, I was quite lucky that I always had a good patient, with good anatomy, good planes. But at that occasion, I had different circumstances. I had a patient who was actually very difficult to operate, a lot of bleeding, very, toxic fat, sticky tissues. It was, not the
Yeah.
nicest procedure to show. But then again, you have to realize that people who are actually enthusiastic enough to watch these kind of surgeries, they know what it's about, they know, and they recognize the difficult circumstance. And so I asked them the evening of the event, I was like, I'm sorry that I couldn't show anything nicer than this. In the end, the surgery went well, but it was not the best educational experience. So you have to realize that that people who engage in these kind of events, they know what they are watching, and they recognize when it's difficult, and they also appreciate you're doing the effort to still do this live. You can also say we'll just cut transmission and we'll take it from there. But I never did that so far, because also sometimes surgery can be difficult, and live surgery is what live surgery is. It's not always, the best of the best cases. So
Yeah, probably one of the most one of the better learning experience probably as well, like, because you have to work yourself, take some decisions there to bring it to a good end in the end. So I think it's could be
yeah.
an extremely good learning experience. Some of the participants here are asking, Ruben, as a surgeon, do you feel case support by MedTech can be equally as effective if it were provided in a remote form?
What do you mean exactly with case
So, like,
support?
if you would have somebody supporting you remotely or on site, do you think remotely can be as effective as having somebody supporting you on site?
Depends on the situation, probably. I would be very hypocritical if I would say no here, because I'm a very strong believer in the fact that educational experience can be as good remotely than on site, sometimes even better. So of course, also support from MedTech virtually is sometimes as good as normal. I'll give you an example. We had our fellow who was actually appointed to be responsible for the streaming. She was instructed and trained by someone of the Rods&Cones engineers team that, and this was done virtually, and this worked out perfectly well. So I think you showed it in one of your slides. Virtual training, virtual education, virtual support has a key advantage of lowering costs. You don't have to, as a company, you don't have to pay a plane anymore, a flight anymore, to bring someone to the other side of the world. I'll give you an example. 1 year and a half ago, I went to Japan, to Tokyo, to train 2 people. That was a flight for me of twice 17 hours. It costed that company to support me only for the flight 8,000 euros.
Yeah,
Is that all necessary? I don't know. I don't know. Maybe I think there might be sometimes, in some cases, yes, it can be an advantage to be on site there, but we have to think about alternatives. Um, and I think that virtual proctoring, remote proctoring, for a specific type of surgeons is absolutely as good or even better.
Yeah. So you think that in the future, a lot of proctoring will probably be done remotely. Do you feel that your colleagues, surgeons, are open to that, or they're very much thinking in a mindset of having proctoring on site?
Yeah, well, yes, but not for everyone. Like, again, another example, a couple of a month or two ago, I did remote proctoring for a surgeon somewhere, elsewhere in Europe. And so the problem was that I was not very much aware of his skills already. So I have been proctoring quite a few people so far, and so for people who are in the beginning of their learning curve, who are still, struggling sometimes at some steps during the surgery, you have to have the possibility to take
Right.
over. You know, if someone is actually deflecting from the way, you sometimes have to bring him or her back on the way and back on track in order to continue. The problem is if you have someone who's very, very novice and you do teleproctoring, it's very difficult to bring them on the way again if you cannot take over anymore. So teleproctoring for me is ideal for people who are already quite a while in their learning curve and who actually don't have difficulties of being redirected in a different sense of direction. So I think it will be key in the future to do teleproctoring, telestration, all this kind of stuff for the right people, not for everyone.
Exactly.
It's not one fits all. You know?
On the right moment, and also what we see, it works really well when there is a personal relationship. No, like if you already have been working together or in an event, or you know each other, if you then proctor somebody remotely, there is trust. No, like it's more hand on the shoulder.
Absolutely. Absolutely. I mean, we are using a methodology in ORC Academy. It's called proficiency-based regression methodology, where we have developed very objective key metrics to train someone. So instead of actually only assuming that our personal experience is enough to train someone, it's like a cook who is actually training someone how to cook just based on his personal experience. Now, what we do is we use our personal experience, of course, but we have a cooking recipe. So we can always, rely and go back to that cooking recipe to bring over the message. Now, it's not because you have a cooking recipe that the training of that young cook will be automatically good. Some cooks will be better than other cooks to deliver the message. Your non-technical skills, your communication skills, the level of giving trust to someone, the level of being calm during a surgery when you're giving a message, that's absolutely key, and that's probably at least as important as having these metrics. But so you need a framework, you need something, an objective message that you want to deliver, but the way you deliver the message is also very important.
Any future plans there with SearchQuest? Like now you're teaching a lot. Is there any remote proctoring program as well that you guys are working on, or is that something that's not right now on the radar?
For me, the sky is the limit, and I think we always started SearchQuest with the idea that if you ask any surgeon worldwide, can you please show me an example of how you should do this surgery? More than 90% of these surgeons, they will go to YouTube. And there you have a huge amount of videos of all kinds of surgeons showing what they can do, but there is no single quality control on that. And so that's the mission of SearchQuest, to deliver actually quality in the OR worldwide, whether it's live stream, whether it's a live surgical event, a webinar, or also the video repository, the video library that we offer. It's to bring quality, and with a selection that is already made for the people at home, so that they don't need to make this selection anymore. And so I think to bring education in the home of people, and whether this is through live stream, webinars, live surgical events, teleproctoring, maybe even in later telesurgery, who knows? That's the ultimate goal. Yeah.
Okay, well, I think we've come to an end. So, Ruben, I want to thank you, and I also want to thank the audience for a great session. I think it was very inspiring, Ruben. If today's webinar inspired you as well, then we encourage you to connect with SearchQuest and or explore how Rods&Cones maybe can transform your training programs as well. So thank you all. Have a good day. Have a good evening. And we look forward to seeing you at our next session. Thank you.
Thank you all.
Thank you. Bye-bye.
Bye.